Nobody went to school for sales. Each of us has our own journey, a journey that ultimately reveals the two opposing forces: the art versus science, the relationships versus the metrics, selling versus sales. What side are you on? This is the Love Selling, Hate Sales podcast.
All right. Hello, everyone. Welcome to the Love Selling, Hate Sales podcast. I am joined today by Joe String. He is an account manager at Integra Chain. We'll learn a little bit about Joe and his journey in sales coming up here. Joe, thanks for joining the show.
Josh, absolute pleasure being here. Thank you for having me.
Yeah, my pleasure. So, we got connected on LinkedIn like a lot of my podcast guests do. And we talked a little bit about the whole hashtag Love Selling, Hate Sales. And we also got a little bit of a dialogue online on your journey. How did you come into sales? Sales is one of those professions that doesn't have a traditional path. And I thought you had a cool story to share. So do you maybe want to start us off there?
Absolutely. And to comment on the whole LinkedIn piece and how we got connected and that whole journey, I would say that a lot of people do look through LinkedIn at that stuff that they want to comment on, but they don't. And when I saw that one, not all of us nobody studied sales, right? We kind of fell into it in a way. And that has been one of my biggest areas of almost developmental education to give younger professionals that want to do well in their careers.
Right.
And I think mine's a great example of that. So we can dive in. So like I mentioned in my comment, I was about 5 months away from wearing a white coat.
Okay.
I was studying to become a registered dietitian. If you're not entirely familiar, typically after you get a degree in nutrition, you do a 1 year, almost like a residency.
Okay.
Where you do clinical practice and other areas of nutrition to get 1,200 hours of supervised practice, and you sit for an exam to become a registered dietitian. And I was probably 300 hours into my internship, about 2 months or so.
Pretty heavy.
And yeah, it was enough to justify not withdrawing.
Right.
But I wish I would have grabbed it for you, but I was working as a host at a bar while I was completing my internship, because these internships are unpaid. I was getting paid like $7.75 an hour, and just to make my groceries, because I had my money to pay rent, all that other stuff. And Josh, it just became a point where it was like, I can't be doing this right now. Right. But even moving forward, I know enough people in sales, and I've interned enough in different companies to learn that sales is a great opportunity to build a career. And
absolutely.
Let's face it, man, make good money. I mean, that's what it comes down to some extent. Now, I do think that there are areas that people should be selling in from a passion standpoint to allow that to carry through their career, obviously from a financial standpoint, but also personal. And that's where I think I went. And we can talk a little bit about the pharma side is what I mean by that.
Okay.
But like I said, was doing the internship, basically determined that I can't do this. This isn't going to be my career. I don't want to be in a white coat, putting in my normal 40 hours. And I sent a blind email to somebody that I had met at a National Kidney Foundation Awards gala about a year prior. He was working as a consultant with the company that I got hired with first, called Pentec Health. And at the time that I sent him the email, about probably 8 months after I met him, he was hired full-time as the VP of sales. So perfect timing. Yeah. I was a young, fresh college grad, basically saying, hey, like my degree is in nutrition. A little background on Pentec. They're a 503A compounding facility as well as a specialty pharmacy. So they make a medication for end-stage renal disease patients that's infused while they dialyze. So it's essentially IV nutrition for malnourished dialysis patients.
Wow.
So coming with a degree in nutrition, a bone for sales.
You had a great background, yeah.
Kind of made sense. And the only thing I didn't bring was years of experience. So sent this email, explained where I was from a professional standpoint, but then also personal. Had nothing tying me to the East Coast, where I'm from, South Jersey.
Okay.
Was living in Pittsburgh when I sent this email. I'm with the Pitt. And he emailed me back and said, look, come in for a meeting. So about 2 weeks later, sitting across the desk with, his name's Tony. I wasn't going to share, but his name's Tony. And I'm going to reference him a lot because
Tony.
He's the reason I'm here. He's really the reason I've been able to do a lot with my career. Him and another gentleman that I may reference.
Those mentors are so critical.
I just spit a little bit.
No problem.
That is probably the biggest thing that I'll try to share.
Okay, great.
For me and my sales career, because looking at my resume, it doesn't make sense that I'm selling, SaaS solutions and cloud-based data as a bachelor's degree in nutrition and dietetics. Like it just doesn't really add up. So long story short, sat down with Tony, and he basically told me we're going to be doing an entire sales organization build out, 14 new territories. Where are you willing to go?
Wow.
And I told him, like, look, man, you want to put me in Detroit? Like, all I want is to become a sales rep for this organization. Right? I knew the money was good. Obviously, we're changing patients' lives. I'm selling nutrition. I mean, everything kind of aligned with what I wanted. So after a few meetings, a flight down to Dallas to interview with the VP of that particular division that I was going to be selling in, and then a phone interview with who became my manager. Let's see, the first interview that I met with Tony was probably November 11th. Let's just throw a date out there, of 2016.
Oh, wow.
And on January 28th of 2017, I signed my lease for my apartment in downtown Los Angeles. So
that's a hell of a move.
I'll tell you, man. Like, I remember I left Pittsburgh on the day before my birthday, December 1st, drove home, and then a month and a half later, I'd ordering furniture, looking at cars to buy in Cali, pack my bags. So, packed my bags, got them on the plane, got off on February 4th was the day I moved. Had my furniture delivered that day, bought a car that night, and then here I am, 2 weeks after that, full-fledged operating account exec in a territory that I had no connections in, really didn't have any hard sales experience, just had a lot of knowledge and nutrition. And like you said, sheer desire to build relationships.
Love it.
Love going into offices, dialysis units, physicians' offices, and just, hey, like, I'm your rep from Pentech. What is it that you can tell me about your patient population, and how is it that our solution can help? That was really where I was at.
That was it.
And it was a cool time, but after about a year and some great sales success from a territory standpoint, personal standpoint, like developing content and such, working with the Pentech team, the West Coast just proved to be too much, Josh. Like I just.
What do you mean by that?
I knew friends,
Oh, okay,
I mean,
gotcha.
I think a lot of salespeople would probably agree. And it's almost like a twofold statement. One, we have the ability to be the least hardest workers in the room. We do.
Sure.
Like we work remote, we work in a territory where no one's watching, and there is an opportunity to do that. But at the same time, you don't get into it because you don't want to work hard.
Right.
You get into it because you want to really, really work hard.
Yeah.
And because I was working so often and so hard, I just didn't really go out. Friday, Saturday would roll around. I'd kick it in my apartment. As social as I am in the workplace, personally, I'd really not. I'd rather just stay inside.
That's super interesting. And that's something we haven't really dove into much, and we probably should at some point. But, like you, I tend to have that extroverted work personality. But by the time I get home, I'm wiped. Yep. And I don't necessarily want to do all the extracurriculars and go out to this party or this, that. And it's a super interesting thing. And I think there's a lot of salespeople that actually feel that and are almost afraid to put that out there because there's this persona of the outgoing, forward-facing salesperson that you almost have to keep up. That's an interesting point. Didn't mean to derail you, but yeah, that's super interesting.
No, not at all. I share it all the time. And I would also say that a lot of times the people that I was interacting with the most were in these dialysis units, or they were in these physicians' offices. And I'm not going to ask a medical assistant that I'm, talking to over lunch about my product if he wants to grab a drink. It just didn't work.
Kind of strange,
So unless I was throwing myself into these social situations, which to your point, when I would get home, it was, I don't want to do that.
Right.
Really didn't have that opportunity.
Right.
So I decided to leave Los Angeles after a year. I think I moved February and I moved back in December. So almost a year.
Yeah.
And I ended up landing at Takeda Pharmaceuticals. So that was my first stint in Big Pharma. Within Big Pharma, I don't want to say I have an opinion, because I do think that it did teach me a lot. Different selling models. The training at Takeda was great. Mm-hmm. Great pharma sales training, which is different than what I do now. But nonetheless, building relationships, maybe pushing the customer to a point where they're doing something that you need them to do, not necessarily that they want to do.
Right.
But at the same time, never walking out with a paper, not putting together proposals. Like, you're following a route, you're giving your messaging from the iPad and using samples to do things. But at the same time, it's different. It's just different. Like, that's the way I'd put it.
I did a short tour in pharma as well. It was a 5-month stint. And I described what you're just saying as being just a walking billboard. The FDA gave you these white lines you had to play within. Yeah. So, like you said, the pharma companies do a great job of training you and getting those talk tracks dialed in and all of that sort of thing.
Yep.
But when you get out in the field, you're a talking billboard. You can only say this and this, these are your parameters. This is what you're going to go in. This is the message you're going to say. And it was funny. I would go in and I'd ask them about their business. Okay. Cause I knew the FDA, I couldn't get in trouble about, I wasn't saying anything about a drug or anything like that. It was just, hey, how's business? And I would get looks like I had, an eye in the middle of my forehead. Like, what are you talking about business? And most of these docs don't talk business. They're, they're clinicians. They don't really think about the business side of things that much. And that kind of was an interesting path for me. But yeah, continue. I know exactly what you're talking about on the pharma stuff.
And I'm sure like once I get through this like long journey that I've taken 15 minutes talking about, we'll be able to get into that stuff, because I think that's another one of the majority pieces that I like talking about. The difference that I've noticed from going from pharma into a role with IntegraChain, which is very different.
Closing.
So did my year stint with Takeda. There was rumors of a layoff, which did ultimately happen, but I was fortunate enough to, and this kind of ties back to that network.
Joe, are you still there?
Author in areas of nutrition and dietetics. And like I said, she came and guest spoke. And when I was able to, are we good? I'm seeing connection unstable. Are we good?
Yeah, we had a little lag there. So
blip, but
you're
we're
back.
all right. Okay.
Yep.
So yeah, she came in and guest spoke, and I was just interested in her role. She was a pharma rep for a small biopharma out of Boston, a product for renal disease patients, once again. And at this time, I had already known Pentech because I had interned with Pentech in the past, and I knew I was probably going to go the dialysis route. So it was, you know what? I'm going to become friends with her. We're going to communicate, and I want to learn from her. Like, that was really the big piece.
Yeah, absolutely.
So, fast forward 6 years, right? Her and I maybe touched base twice over that 6-year time frame. And her company, her former company, she had moved on, was hiring a sales rep in West Philadelphia, where I was for Takeda. Pretty much all of my previous experience, pharma, dialysis, and from more the personal side, a good $30,000 to $45,000 pay increase versus what I was making at Takeda. So
hard to argue.
I interviewed with her help, and I got it. So that was my last stint in pharma, which was from I started in March of 19.
Okay.
And I ended up leaving in December. So it was only 10 months. So I guess my whole pharma career, or selling in the medical field to physicians, was about 3 years long. But with that company was called Akebia. Fantastic company, unbelievable people. There's where I do feel that I met a lot of pharma salespeople that were good salespeople. Like they were very good at directing their physicians to where they needed to go. And what was different about that area of sales is that dialysis patients, they're all on every medication you could possibly think of, right? They're on some form of statin. They're probably a diabetic. They're probably on a lipid lowering agent, which is a statin. But nonetheless, they're on a slew of different medications. So when it comes to making a decision for the product that Akebia promoted, or that I promoted with Akebia, there was a long list of choices, but they were all branded, and it all came down to who can differentiate the best and who can get me to try it. So with Akebia, met some great salespeople. It wasn't my strongest 10 months.
Okay.
Truth be told, like I did not perform that well. My territory was in the bottom when I got hired, and it didn't climb much. So while working with Akebia, gained more exposure to life sciences, some different things related to market access, like how payers pay for drugs and things of that nature. And I found this opportunity with IntegraChain. So I started with IntegraChain in January. What IntegraChain does, really interesting stuff, is essentially everything when a physician decides to write a script for a patient. Up until that product gets filled. And even after that, like if a patient's getting refilled for like a rare disease med, like an oral oncolytic or something for, like I said, a rare disease, we're handling the data, we're handling the contracts involved with the payers, and we're doing other things like financial calculations such as gross to net on behalf of life sciences companies. So our clients are, Merck, Pfizer, AstraZeneca, like big pharma, all the way down to pre-commercials where we really focus. Because back in maybe the 90s or even before that, small company comes up with a product in pharma that's treating a rare disease that's worth millions of dollars, gets bought by Pfizer, gets bought by Merck. They end up getting swallowed up. And today, these small pre-commercial companies are launching. I don't know if you've ever heard of Spark Therapeutics, but it's a company that's actually based in Philly. And they're curing blindness. It's some form of DNA, genetic I don't know. I know nearly enough, or I don't know nearly enough about it to actually comment on it. But that was one of IntegraChain's rather large clients. So our organization basically took everything pre-launch for them related to their contract, setting up their payer space, and we're going to kind of walk them along the way until they're launched. So we're selling that consultative service. There's some SaaS involved, other advisory services, and that's realistically what we do. So that's kind of my whole track record through sales. It started with Pentech. I ended up at Takeda and Big Pharma. went to Acadia, more of a small pharma company, and then got myself to IntegraChain. And a majority of that was done via networking, whether it be through LinkedIn or people that I knew from a past life that I maintained contact with, because if they needed my help, I was going to offer it. But at the same time, maybe there's something I could get to. But yeah,
well, it seems like you feel you're in the right place now.
I do. I really do. And I say that because you mentioned something about the relationships that you build with clients. And what I find interesting in pharma, which I'm sure you can comment because you did it for 5 months, it's not that there's no relationship with the doc or anything, but even today, there are so many reps going in, especially primary care, but even specialty. There's just so many reps going into so many offices with so many different meds. And frankly, physicians' hands are so tied when it comes to things like managed care. It's really just managed care. Like who's paying for this and what's it going to cost my patient? So from a clinical differentiation standpoint, reps really can't do much. And to your point too about FDA having these white lines, like they can't take docs out like they could before the Sunshine Act.
Totally.
You can't do the things that in our space we can. We can really build a relationship. If I'm in the town, one of my clients is, and I say, hey, let's go to lunch. Like, let's go get some drinks. Let's go do these things. A really important piece of sales that really just doesn't exist in pharma. And then to kind of re-reference your question, the fact that it's the right place, I'm still dealing with life science manufacturers. So I still get to talk about pharma. I still get to speak to the pains that some of these people might be having, especially because I felt them as a rep. But I'm not carrying the bag. So it's nice.
See what I love about it. We talk about no traditional path first for sellers, right? But you do need to, if you're going to focus on the right things and relationship building and those things, you have to have a passion for what you're selling. I feel at some level, right? So you've taken this path of potentially being in a white coat in nutrition and diet, right? But you didn't leave that behind totally, right? You're still in a field where you're speaking a language that you know, speaking a language likely that you love and you have some passion about, and you're using in a way to develop relationships in a space where now your education went from very clinical, direct, focused on diet and nutrition for this particular application, but then you built on that each phase, right? Pharma may not have been the right fit. It wasn't the right fit for me, but guess what? I learned a lot of things there, just like you did, right? You learned how to take what you know, apply it to something different, right? And then you learn something there and you can take that and apply it to your new field. And it's given you this that's the thing about sales. It's an ongoing education process, right? You're always learning and applying different things. And I love the journey. While it may seem like a completely wild path and divergence, it's really not. No, you're just doing it in an effective, impactful way for you.
Absolutely. And what's also interesting too, like, and what I was hearing when you were saying that stuff is like, when I think about the passion, right? Like, what is it I'm passionate about? Like, is it getting the medications that I help our manufacturers eventually make accessible to patients? Like, is it changing those patients' lives? Is it making the lives easier for the docs because they want to use these products, but they can't? Is it reducing the overall cost to healthcare by making things easier for manufacturers? What it really comes down to, I saved this one for last because I know that's what it is. Because when I start to talk to somebody about where I come from, right, as a pharma rep, fighting those battles with docs about, like, you want to use the product, you wrote it, and it cost your patient $85. They didn't activate the savings card. That's why, like, it's almost like a predetermined perception that any product the doc wants to write is going to be tough to get. And what we do is help that not be the case. So when I'm talking to somebody that's a part of a manufacturer that we work with, the first thing I'm talking about is how important it is to not have a physician form that opinion of your medication. And it's improving the lives of the reps. Like, that's really what I'm doing. I'm trying to make pharma reps' lives easier by making products more accessible and thus making that conversation with the doc easier. And that's why I'm so passionate about it, because I fought that battle and it sucks. It's not a fun battle to fight. And I found that passion along the way throughout my journey. So.
Well, yeah. And, that's what separates, I think, your ability to put yourself in the shoes of all the different people in the chain.
Yeah. Sure.
Everyone from the rep walking in the door to the physician, to the patient who has to go fill that prescription, to the perception the patient has when they get written a prescription. You've essentially put yourself in everyone's shoes along the way. And now your prospects and your customers in your new role can see that.
Yes, exactly.
It doesn't just come through as passion that's artificial. It's, listen, man, I've been there.
Exactly.
And this is what I'm trying to do. And I think that's the one of the most interesting things that sellers can do. I delivered a workshop yesterday to some marketing and sales folks on sales and marketing alignment, right? And one of the things that we talked about is like, listen, put yourself in their shoes. They're people just like you, right? You know, you have all these perceptions about sales, marketing, and marketing as, you know, perceptions going both ways. Put yourself in their shoes, find out what their day is like and what the struggles they go through to meet their goals each day. And I guarantee you're going to have a different perception of that individual. And you might have a little bit more empathy when they ask you a question about X, Y, Z, and instead of rolling your eyes and saying, oh God, here's marketing harping on me for X, Y. Guess what? There might be a reason for it. And if you took the time to understand that, it would help that relationship quite a bit.
Yep. And with that in mind too, like the whole idea of putting yourself in somebody else's shoes, right? Mm-hmm. And this is kind of unrelated, but it's something that I've been working to, you know, build from like a content standpoint for my own education, consulting down the road, right? In terms of sales. I don't necessarily know what I want to call it yet, but it's this whole idea of when I'm talking to somebody, and when I do this most often when I'm talking to someone that is interested in sales, but they don't necessarily know why, and they definitely don't know how. Because answer me this question, Josh. How often do people tell you? I mean, we kind of touched on it in the beginning, but I think it's even more prevalent when you're actually talking to salespeople. Do people say to you like, "Oh, you're in sales. You've got the personality. Like, oh, you're likable. You'd be so good at sales." And it's like, guys, like I think that's super important, but that's not all it is. Yeah. You know, sometimes it's having the conversation that not that you don't want to have, but it's kind of being comfortable, being uncomfortable, especially when you're dealing with someone that doesn't want to make a change. Yeah. And sometimes I think that's the hardest part to convey to somebody that wants to go into sales. Like, for sure, it is hard. Like, you're not just walking in and saying, hi, like I'm so-and-so. You read the name tag and I've got this great no, people don't want to talk to you. And it comes down to that relationship piece that sometimes is the difference maker in being able to have that conversation. But when I try to talk to people about how to determine what questions they should ask and how to find out what the actual pain is that a customer may be having. Right. I essentially, like, to your point about putting people in somebody else's shoes, I always call back to my nutrition background. And although it's very unrelated to my selling now, when I used to do nutrition counseling, which I did when I was an undergrad, very, very, what's the word I'm looking for? Like offline conversations, like not whatever. Sure. It was always about finding out, what do these people understand currently about nutrition? What is it that they're currently doing? Why are they doing it? Right. What are their biggest barriers to making the changes that are necessary to actually reach their goals? What are their goals? Why are they their goals? And what's their timeline? Yeah. All of those questions can be applied to anywhere. Like, they can be applied to a manufacturer that I'm calling on. They can be applied to a doctor that I'm trying to sell a product. And it's really talking to someone who's interested in becoming a better salesperson about, what is it you're trying to do? Like with this person, what is it you're trying to sell them? Right. What are the answers to those questions that I just asked for this person's area of development or business? Sure. Doc's trying to treat a product. Why? Like, what's the biggest barrier to him being able to treat that product? Yep. What's his current habit? Where did he learn that habit? And how can we break it? Yep. And thinking, like, it's almost like writing those questions out and then just exchanging the words that are nutrition related for whatever it is that you're trying to sell. And then all of a sudden you have an entire dialogue that is a sales call. For sure. I don't know. I guess to your point about putting yourself in someone else's shoes, that's exactly what I do before any call. And in terms of understanding their pains, that's important. But realistically, it's helping me form what questions I'm going to ask and ultimately build a relationship. I mean, if I understand that someone's trying to do this, and I can just relate and say, like, look, let me take a step back. I was a rep, and I totally understand that when you guys don't have access to your meds and you can't get them filled, not only does that drive your sales force morale down the tubes, but it also affects your bottom line. And if those things aren't productive, then you've got no business. Yep. And I get that because I've been there. I don't know. I can go off on a tangent about that.
No, well, I think there's a couple really key points in that. And, one is the perception of the extroverted salesperson. Yeah. I think sometimes I think that can backfire if you do have that personality that seems like the typical salesperson.
Completely agree. My boss used to tell me at Akebia all the time. His name's Kevin. And if oh my gosh, if he were here, but he always would tell me after sales calls, because I would always walk into the dialysis center for a lunch or even a 5-minute stand-up. Fired up. And AA, dietitian, whoever it was that was in the lobby. Oh my gosh, he's our favorite. He's the best. Like, we love him. And the numbers aren't moving. Sure. So we'd get in the car and Kevin would be like, they really like you in there. And I'd be like, and I know in the back of my head that that doesn't matter. Like just because I have this likable personality that people want to high five is exactly how Kevin would say it. Like you can't just go in there, high five, and doesn't mean that you're driving business.
Yeah. Some of the best sellers I know are highly analytical, very introverted, critical thinkers. And, you know, they take a consultative approach just naturally because they're not bringing that natural, you know, forward facing kind of perception of salespeople thing forward. And it brings me to the second point from what you said. So if that perception of how you should be, you know, kind of could get in the way sometimes, the questions you ask, to your point, 100% matter. Right? Sometimes it's less about what you're trying to persuade someone to think or what you're saying or what it is, but what questions and the way you ask them will form someone's perception about you more than anything. So being able to take a step back, be a little bit more analytical, ask questions that you say, put yourself in the shoes of where they are. It makes a huge difference, right? And it kind of can help combat some of that. Like when you said that earlier, I was thinking, when people ask you you're in sales, not only they say, oh, you have a face for sales or you have that personality or whatever it be, I always love when you get that, oh, I could never do that.
I know.
Right. And it's like this backhanded way of saying, bucketing you with every telemarketer and car salesman in the world, right?
Pretty much.
Right. So, and you know, whatever it may be, like you said, another tangent, but I think it's super interesting that the questions you ask certainly do matter. And it helps you put in other people's shoes. So you've mentioned a couple of times content. Talk to me about that. How do you use content in your current role? What does that mean to you now? And you've mentioned something in the future. Talk to me a little bit about that.
So what I would say in terms of my role now is it's borderline non-existent. I mean, I've voiced to IntegraChain a couple of times that I'd love to get involved with some of their sales training development and such.
Sure.
2020 is such a big planned year that I don't think that is what they want me forward thinking as opposed to selling. I'd rather just build my territory.
Yeah,
but from the personal side, and this is exactly what I was talking about and you mentioned with the future, it's referenced on my LinkedIn. I don't do too much with it, although I do have somebody that's currently in the works right now, and I'll add some color to that, but I'm calling it Peak Performance Consulting.
Okay.
Don't ask where the name came from. One day I was driving down the road. I think I saw a sign for a business that was had an I in it, but instead of being like let's say it was Tide, it was TI, but then it was a long I and then a deep no E.
Okay.
And I was like, you know what? I like that. And I was like, all right, let's talk about what we want to do. I was like, well, we want to reach our peak. And I was like, boom, there it is.
There it
I'm
is.
going to call Peak. Yeah, don't know, but I like it. So I've got it on there. I've got the website and everything. And what I would say that I want it to become is full-fledged sales consulting, right? My first sales trainer was a consultant, NJR Performance Consulting. Nick, fantastic trainer, arguably one of the most influential people that I've met in my sales career, mostly from a career standpoint. You know, my man would roll in, lead the class, develop the content, have another assignment in 3 weeks. It was like, wow, like I want to do that.
Yeah.
But I was very far from that point. But ultimately, that's the goal. So that's what I'd like it to become. But in the now, and what I didn't reference a ton throughout my sales journey is that when I went from Pentech to Takeda, right, which was I resigned Pentech in December of 17, started with Takeda in March of 19. Well, why the gap? I actually took a gap job. It was really hard to interview with Big Pharma on the East Coast, living in the West. So I got a job as an account manager for a staffing company that focused on manufacturing, particularly food manufacturing. Again, huge don't ask. However,
big departure,
you're not kidding. But it was a very helpful job given where I am now because I got to understand, one, how LinkedIn Recruiter works.
Right.
That was massive. Like knowing exactly what a recruiter might search on LinkedIn to find candidates. I got to see the back end of I forget what the name of the software was. It was proprietary to the company, but I guess a candidate management software. And if they have a pool of candidates and they're looking to fill a job, what do they type in for the Boolean logic to find a list that they're going to call?
Nice.
So I took that, and what I did was, and I did this frequently, was I would always have people reaching out to me once I worked for Takeda. Hey man, like I see you work in Big Pharma. Like I know that you had that job out in Cali. How'd you do that? How did you get there? Like, how can you help me get a job with one of these organizations? Because outside of sales, people want to be in R&D, want to be an engineer. They want to do these things with pharma because it's a huge industry.
Huge, a lot of money. Yeah.
Exactly. So I started thinking, like, how can I help these people, you know, be more noticeable on job boards, be more noticeable on LinkedIn, be more effective with LinkedIn, because not everyone knows how to use it. And not everyone's even comfortable using it, which I understand.
Yeah.
But that's kind of where Peak is now. It's more of the career coaching, particularly sales, and even more specifically pharmaceutical sales, because that's where I consider myself not an expert in the sales side, but finding your way in.
Yeah, absolutely.
Networking within, pretty strong.
Yeah.
So like I said, in the now, it's what I'm calling LinkedIn optimization.
Okay.
Doesn't sound, I mean, I kind of like the title. I think it's a little non-original, but that's
it's
okay.
Broad. Yeah.
But essentially, most people that I speak to that want to get into pharma sales, or they want to get into sales in general, or they just want a prettier resume, I start with like, all right, obviously let's look at the resume, and I do resume writing and resume overhauls and stuff like that. But I think the bigger piece is LinkedIn. And I referenced earlier when I went from Akebia, well, throughout my entire journey, I leveraged LinkedIn a lot.
Yeah.
I found my job at Takeda on LinkedIn. I called the recruiter, left a voicemail. She called me back. Akebia, I got contacted through LinkedIn. Integra Chain, I messaged the recruiter and got the job through LinkedIn. So like LinkedIn has a ton of power.
It does.
I mean, it's how we met.
Absolutely.
And when I would talk to some of these individuals about what they're using LinkedIn for, it's, I mean, I like things here and there. Like, I think I want to connect to this person because they're like the director of HR. So I connected to them and I'm like, that's not the angle. Like that's not the angle. Okay. And let's fix that. And like, let's look at what your description says, and let's look at your job descriptions, and let's spruce up the content a little bit.
Yeah.
Like if you were an inside sales representative for ADP, right? Big payroll software company. You didn't just sell human capital management software. That's not what you did.
Yeah.
You did so much more than that, and so much more that can possibly make your application noticeable on a job board to any company. So that's a lot of what I do. I mean, it kind of goes with the resume piece, but it's also within the LinkedIn part. And then the third one, which, like I mentioned, I've got somebody working through it now. She actually has an interview at 4:00 today.
Oh, great.
I know. I'm super excited.
That's awesome.
Is resume or interview coaching.
Yeah.
You know, just how do you interview as a salesperson? And it's different. It's definitely different. You know,
It sure is.
I try talking to plenty of friends who are engineers, R&D, like I mentioned, even physicians and clinicians, that their interview is their resume. Like, where have you worked? What experience do you have? What do your credentials say? Like one of my best friends, he's got the MS, RD, LD, CSCS, CSSD, and he's going for a PhD. So I'm like, any job you want to get,
you got all the letters.
Nutrition, you got it, man.
Yeah.
Like you just need to show up. And now I have a bachelor's degree in clinical dietetics and nutrition, but I sell SaaS consulting services to life sciences manufacturers. How? It's in the interview. What can you speak to? What did you learn at each of your experiences? Not what you did, but what did you take from it? What did you get better at? I actually learned that from a recruiter somewhat recently, and that has amplified my ability to interview and coach others how to interview significantly. But in a nutshell, in terms of content development, it's website content development. Down the road, if we're talking about sales training, it's taking a company that, call it pharma, call it SaaS, call it a startup that just doesn't know where to go from a selling standpoint.
Right.
Give me what your marketing messages are. Let me put together essentially education curriculum to give to your salespeople and teach your salespeople and teach them how to sell it. What questions are they asking? Who are their stakeholders? How do you get past certain people? And to your point earlier about both of our points, pharma versus now, how can you move it from, we call it M. I don't know if that's standard sales, but M1 to M2 to M3 to M4.
Whatever your stages are,
Exactly. How do you get it to that final stage?
Yep.
And that's not something that's always understood. So that's what I like to try to develop content around. It's all based on various different models. Challenger, I've learned, and Spin, and all those guys, but also the one that I mentioned with putting, like you mentioned too, putting yourself in your customer's shoes.
Yep.
And kind of throwing something, like sprinkling a little bit of that sauce on there. It's all just sales related, resume related, interview related, just everything sales, man. That's really what it comes
well,
down
I'm
to.
not sure if this is helpful, but one of the things that you articulated very well early on in the show was your ability to go into territory, learn it, be self-driven, and work. Mm-hmm. When you go into an interview with someone who's, especially if they're hiring field sales, that's what they're trying to find out. Can I trust this person to be autonomous and work on their own? There's so much of that, like beyond what you say and how you say it. They want to have that feeling that if I just plop this person into the field and let them run, they're actually going to run and not, sit in their pajamas all day and play Roblox until someone calls them, or you know what I mean? Like,
yeah, absolutely.
That's one thing for sure. And then I think one of the other things that is super important for anybody, because we all have experiences, no matter what those experiences are.
Mm-hmm.
Like you said, a job that is a total tangent, you've managed to figure out how to use that experience in your today, right? So being able to draw on your experience and speak people's language is super important. And I'll use an example. In the company I was at right before pharma, we used to build little businesses. We were an e-learning company, but we weren't going to go compete with the big e-learning players, right? That market was so saturated. So we found vertical industry markets that were low on the tech pole, on the tech landscape, and had a heavy compliance. And we built e-learning programs for those specifically. And we partnered with the subject matter expertise. So through that, I learned about insurance. I learned about mining and safety. I learned about green building and OSHA. I learned about all these different things. And it's funny, you go talk to a big insurance carrier now, we might sell marketing to a big insurance carrier and say, oh, well, I start speaking their language, like, oh, you get what I do? Yep. Totally. I did this. And it's like this instant trust builder, because everything you're trying to do in sales is build trust. So
absolutely,
understanding who that person is and using just even terminology or language to show that you understand their world makes such a big difference. That's one of those things, if you're coaching salespeople, like, draw on your experience as much as possible and tell those stories.
Yeah. And that's an interesting point too, because I remember when I first got hired by IntegraChain, I remember thinking to myself, week one, they gave me their sales playbook. Right. It's like, all right, open it up, start reading some of the stuff, learn some more about our solutions. And I'm reading gross to net forecasting and GP and 340B analytics. And I'm like,
yeah, it's good stuff.
Huh? I'm like, well, what's this? But then part of me is thinking to myself that as long as when I'm talking to this market access VP or CFO, that I can speak to the importance of having these things in place when product is launched, or giving their field force the sheer ability to act on insights that come from our data, because I've been in the field and I know what that feels like. To your point, trust. I mean, it's not 100%, but it's damn near 99.
Yeah.
And it's super important. Yeah. I mean, it's just a great point.
Well, we're looking at 4 minutes here, and there's one thing I just want to get your take on, because you touched on it, and the whole podcast is based on love selling, hate sales, right? And the concept here is that if you focus on selling and being a quality seller, like we said, having good conversations, leveraging experience, telling stories, everything that we just talked about, the sales will take care of itself, the numbers, right? And you mentioned that example in pharma where everybody loves you, but it wasn't translating to sales.
Exactly.
So what are your thoughts on that? How has that changed for you now that you've had that experience where the way you were selling didn't translate to what you're doing today and focusing on being a quality seller? And does my theory stand up, or does it not?
Absolutely stands up. Absolutely stands up. And this is how I interpret it in the now. And if it comes off in a way that doesn't make a ton of sense, I apologize, but this is exactly what I'm hearing. It's the fact that at the end of the day, like, there's always been this, I guess we'll call it a phrase, that people buy from people they like. And I do think that is extremely important. However, just because these offices like me, just because the doctors like me, did not mean that they were going to write my product.
Absolutely.
There needs to be value. And the value is not just in the relationship, because at the end of the day, we're selling a solution to what is likely a problem. And if that problem's not being solved, which I'm not solving by bringing Chick-fil-A or by bringing Dunkin' in the morning, I'm solving it by identifying patients that could benefit from this product, or I'm solving it by finding out where access barriers exist within a manufacturer's business and allowing our data or our solutions to fix it. And I can do that while being likable, of course.
100%
huge deal. But at the same time, if there comes a point where there's an opportunity that requires, I think we called it constructive tension when we learned Challenger. If that presents itself, you got to be able to do it.
Yep.
And that's where I think that likability, that general salesmanship, personality that people think exists, gets flattened.
Totally.
because that's important. So to your point, loving selling, but hating sales, sales will take care of itself as long as you sell effectively. If you're there to solve a problem, you do it in a way that you're actually liked, and the problem can be solved by one of your solutions. And you're also selling that solution. You're not just selling the benefits of what your problem is.
Totally.
The metrics will move.
Yep. I agree. I like to say conflict sells. If there's no conflict, you're likely not going to sell anything.
We call them transformative events where we exist. So
I like it. Transformative events.
And believe me, I've taken on a territory of primarily existing customers, and a lot of them were either recently sold a solution or they're up for a renewal, and I engage them for the renewal, and I'm like, hey, I'm Joe, I'm your new account manager. I want to get this renewal in motion. If you want to set up an intro call, more than happy to talk. And of course, I want to find out where there might be pain and such. But if they don't have a product coming to launch, or if they just didn't scale, or if they aren't bringing on more salespeople,
timing's not there.
Time's not there.
Yeah.
And I'm not going to be the person that's not likable and just push them to a point where they're like, this kid's annoying. I don't want to talk to him.
It's obnoxious.
And that's part of the beauty of the personality, but that's more people skill stuff. And that's a whole nother conversation.
You're right. It absolutely is. All right. 1 minute. If you want to pump up peak performance, if you want to pump up your current gig, tell everywhere where to find you, what to do. Give us the pitch.
Cool. All right, guys. So, Peak Performance Consulting, PEK, can be found on LinkedIn. Right now, focusing primarily on resume building, interview coaching, and what I'm calling LinkedIn optimization. It's the ability to network through LinkedIn and possibly find jobs that people would want to have. Can be contacted through the website. Got email. I think I got a Facebook page, got LinkedIn, and I have Instagram actually, which is not really active, but it's there. And it's just PEK. Performance.com, peakperformance.com. So that's what we got.
Awesome. Joe, thanks for joining. Appreciate it.
Josh, really appreciate the call, man. Stay in touch.
All right.
Bye-bye.